Thank you. Well, it's certainly great to be here. I represent Assemblyman Wagner, and he sits on the Health Committee up in Sacramento. We represent the 68th Assembly District, and that comprises of Anaheim Hills, Villa Park, Orange, Tustin, and parts of Irvine and Lake Forest. And we're fortunate we were in a board meeting with Shri as we were learning more about your organization. Healthcare IT is blowing up. I mean, in a good way, of course. It is a fabulous, and it's an exciting field to be in because there's so many areas where a lot of this can be implemented in our system. A little bit about what's going on in California. Obviously, with the Affordable Care Act, the legislature also passed AB 1X, which will also expand eligibility requirements for residents under the age of 65 above the 133% level. What does that mean for us? It means that additionally, we're going to be covering almost 1 million more people in 2014. And with the Affordable Care Act, we're going to have 2.6 million that are going to be joining on. So what does that mean for hospitals? What does that mean for a lot of these areas? Well, it's going to have a lot of costs, and there are going to be ways where we need to look into funding with regards to electronic health records. And that was one of the things that I've come here to also say, to really express my support. And to say that the Assemblyman is really looking for ways, because we were just discussing this, healthcare IT, these are one of the ways where we can truly improve the access to healthcare as well as the quality of healthcare. Because we know that with the additional individuals that are going to be put onto Medi-Cal and Medicare, this is going to be crucial. So I just come to show my support for that. We actually have some recommendations from our health committee up in Sacramento. I don't know if you guys have ever heard of Cover California. Cover California, what it is, it's an organized marketplace that has been designed for these new quote-unquote individuals who will be eligible to purchase health care, and it's an area where they can purchase that. The Sacramento Business Journal, they just announced that Cover California was soliciting applications for $43 million in grants. I'll say that again, $43 million in grants, and $40 million will go to groups that target consumers who are eligible to enroll in Cover California, and the other $3 million will go to groups targeting small businesses. So these are the kinds of programs and funding opportunities if HIMSS were to be wanting any part of it. I encourage you to go on their website, Cover California, and look for ways. But other than that, I'm here to also entertain any questions and just to thank you guys for really being a part of this organization. There are great ways where you can advocate on behalf of more additional funding for this because it's very critical, and we're happy to be here in support. So thank you for having us.
Scott.
Hi, my name's Scott Peotter. I work with Assemblyman Allan Mansoor. Allan's from Costa Mesa. He's on the health committee up in Sacramento. And in case you guys haven't been following Sacramento and Sacramento politics, after the 2012 election, there's what we refer to as a supermajority of Democrats up in Sacramento. What that means is they've got 2/3 control of both houses of the legislature. So what that means is that Republicans are irrelevant because they don't need a single Republican vote to do anything. It used to be that for the budget or any kind of tax increase or putting constitutional amendments, et cetera, onto the ballot, you have to have a 2/3 vote, which they do. Now they can do it without Republicans. It also means Jerry Brown is irrelevant because they can override any veto that the governor decides that he wants to veto on one of the laws or any of the laws. So it's a different environment. It hasn't happened since the 1800s, where there's been a party with a supermajority. I guess that would be the bad news because we definitely have a single party control in the state. The good news, if you can call it that, is that Jerry Brown is the moderating voice in Sacramento. I know it's kind of surprising as far as his reputation has been very, very leftist in the past. But he's really the guy that's keeping the liberal faction in the legislature from going and doing whatever they want. For instance, right now there's an assembly bill that's trying to limit nonprofit hospitals as far as how much profit that they can make, as though they have extra money that they're just throwing around. It's driven by the unions. It's driven by what they're alleging as far as patient dumping. and rerouting. Though that's the type of thing that Assemblyman Mansoor and Assemblyman Wagner are out there trying to fight and trying to prevent that from happening. I know it's a #1 target for your organization as well as the Hospital Association, and there's a lot of interest in keeping that from happening. We had a fun time just talking with your advisory committee. Your advisory committee was, and it was kind of like, what can we do? What can you do to have an impact in Sacramento? And I would say, boiling it down to anything else, is you need to stay informed and you need to stay all over your particular assemblyman, because believe it or not, even the Democrats, every 2 years they have to come back to the voters and get elected. So the people with the ultimate control are the voters. And so your impact over the voters, letting them know what's going on, is really crucial. And we want to also repeat, we really appreciate, like Sam was saying, the whole IT aspect of healthcare is going to be crucial if we're going to come anywhere close to not going insolvent. Lots of industries have really streamlined their ability to provide services through IT, and the medical industry has got that opportunity as well. And we understand the amount of money you're putting into it, and we're trying to tell others in Sacramento the same thing, and how important it is to making healthcare work. California's got another part of notoriety, or they're notorious again. They're going to be the first exchange under Obamacare or the Affordable Health Care Act. And we're going to end up being the experimental chamber for the rest of the country. So this group, particularly your NorCal and SoCal groups of IT, are going to be critical on what happens across the rest of the country. So you guys have the opportunity to be out there and be the leader. We're listening, we're trying to get the message across to the other people in Sacramento, and we really do appreciate your input to us, your expertise to us, and trying to encourage you to keep up the struggle, because it is working. Thank you.
Yeah, and I'd also love to add that our offices are always open. Local advocacy with the district, you guys coming to us and letting us know, look, I employ 50 people in your district. I employ 100 people. I employ 5 people. These kind of things really matter to us, because believe it or not, and we can all have differences of opinions in terms of politics and partisanship, but they're all trying to make a difference, and we need to hear your voice. If you don't share, if you don't speak up on behalf of the issues that do matter, a lot of times because of the myriad of issues that California loves to involve itself in, we can get lost in the fray. So I do appreciate Cherie and all the work that John is doing in really mobilizing this, and we're so happy to be a part of it. So thank you guys, really.
Let's have a brief applause, and I have a plug to make before you guys leave. You heard hi, I'm John Risk. I'm also on the Policy Planning Committee. And we have a site at our chapter website on policy, and many of you may have not been to it. It's not a popular site, but it's one I want to make you aware of. You click the advocacy bar on the menu to the left, and you get this page. And both of these gentlemen asked you to speak up and be heard. You know, we are the people. We represent IT for our organizations or clinical informatics. We also are local residents, and we have local issues, and they'd like to hear from any issue you have, basically. And we have a way at the bottom here, or actually just click here, right there. You can get involved easily. And let's see how long this takes to load. But we have these plugins and widgets down at the bottom. And very quickly, you can look up state widgets. You click here, not to be confused with state midgets, which sometimes people in Sacramento are called.
Mental midgets.
Right. But if you wanted to contact your legislators, you simply plug in your zip code there. I'll plug in mine, 92660, enter. And in a moment, you'll get this California Legislative Action Committee, and it's going to show who all my elected officials are. And just think, Allan Mansoor. If you click here, they show up in live. So here's how it works. It's very simple. And if you have a message, HIMSS often will send out an action alert to members of HIMSS. And they may have a call to action, and they'll prepare a sample statement that you can then use this widget to apply to or to have sent to your various representatives. And I've used this before, and Senator Boxer and Feinstein have written me personally in response to those things, so the system does work. So that's all I have to say. Sharif, thank you for helping organize this today, and we'll have Willa Fields in just a moment.
Thank you, folks. I want to thank a lot of people here to make this possible. The board of SoCal HIMSS, our president, Despina Hopkins, John, Kim, Ian, and Nicole. We got 4 people who are part of the advocacy committee. We were able to bring these 2 gentlemen here to share their importance with you guys. There's ways to do this. You saw how it's easy to get action done. Just be more active and you can get more response. I mean, all these guys are saying, we don't know what you guys want. So if we have a way to do this and we have a way to express ourselves, this is the way to do it. Thank you.